Good morning, good evening, good afternoon, wherever you are. It's wonderful to welcome you all to this new webinar, Enhancing Dementia Education Through Global Best Practice. I am Paola Berberino. I'm the Chief Executive Officer of Alzheimer's Disease International, and it will be my pleasure today to run through this webinar when we have some extraordinary speakers that are doing wonderful work to present dementia education to you. Now, as every time that we do these webinars, I will ask you first and foremost who is joining today. So, Jane, next slide, please. That is me. And then next slide, who is joined us today. So we're going to run a poll, so we have a little bit more of an idea of who you are and from where you are. We know that there were over 1,000 people registered for this webinar, so you are welcome to introduce yourself, as many are already doing in the chat line. Tell us who you are and where you're joining from. And then as you hear the webinar, you will be able to put your questions in the Q&A box. Now the poll, if you could be so kind as to fill it. Can you let us know whether you are from a university, a care home, a daycare center, you're a formal carer, you're an informal carer, whether you're from government, you're a person living with dementia, etc. So we'll leave you a few seconds to fill the questionnaire. As I can see that many of you are still joining, thank you. We are at 340 and counting. So please fill the poll. And once you have done that, you're very welcome to continue introducing yourself into the chat area. I can see that's going up very quickly. And I can continue to ask you to put your question in the question and answer area. So we are going to close the poll now. Thank you very much. And so we know there's plenty of you from university. About 5% from care home, 6% from daycare center, formal carer, 6%, informal carer, 7%, government, 7%, persons living with dementia, 2%, other, 26%. And I don't know if I can actually read the very last one, but I think that gives us the gist. Thank you very much for being with us today. So let me go into the nuts and bolts of this webinar. Jane, if you can go to the next slide. We are the global organization that advocates for Alzheimer and dementia. We were established in 1984. We are an umbrella organization of 105 Alzheimer's and dementia associations around the world. We represent our members and all of you, for that matter, at the World Health Organization, the United Nations, OECD, other global and regional bodies like the G7 or the G20. We promote World Alzheimer's Month, and we are the publisher of the World Alzheimer's Report. Our vision is prevention, care, and inclusion today, whilst we wait for a cure tomorrow. So thank you for continuing to introduce yourself. I have here now a slide about us being a charity, and we are a non-for-profit organization. We are funded by generous donors, so if you're able to and would like to donate, you can use your smartphone to scan the QR code on the slides or visit our website. You can make a real difference by helping us with your donations. We make sure that all the things that we do are freely available to everybody in the world that wants to access them. So next slide, please. We also run an international conference. Next one, we do them every 2 years. Next one is going to be from the 14th to the 16th of April in 2026 in Lyon, in France. And it will be co-hosted by ADI, our member association in France, which is France Alzheimer et Maladies Apparentées. And we have abstract call open now. So given that so many of you are from universities and from care homes, we accept scientific and non-scientific abstracts, and you are very welcome to submit an abstract and see whether you're picked for an oral or a poster presentation. The abstract submission will be open until September. But the sooner you submit an abstract, the better it is for us, so we can start looking at it and take decisions about the abstracts. Now, the next slide, we will tell you a little bit of abstract topic that may be relevant to you, like support for dementia carers, dementia awareness, dementia as public health priority, and dementia diagnosis, treatment, care, support. For example, model of care, well-being and quality of life, education and training for informal carers, migration and the importance of cultural context. So as you can see, there is plenty of abstracts for everybody. There is 49 topics that you can submit. This is just a small selection, so please scan the code and submit an abstract for us. We would be delighted to hear from you. So thank you to all those that are still joining. Now, let me tell you something in the next slide about the importance of dementia education. So next slide, please, Jane. Dementia education enhances the quality of life and independence of the people that it impacts. It enables person-centered, compassionate care, which is very important for us at ADI. It empowers carers, families, and professionals. It encourages culturally sensitive approaches. It supports government policy and funding, and it builds a skilled and confident care workforce that clearly does its job better. It also drives innovation and cross-country learning, and this is what we do a lot of at our conferences, where you can hear a lot of practical examples. So next slide, please. But now let me stop here and let me introduce our wonderful panelists, whilst at the same time also thanking Jane Ciborra and Megan Anderson, whom you cannot see, but they are here in the green room with me and they're running the webinar. And first and foremost, Amalia Fonk Utomo, our head of training and accreditation, that has created this panel and put it together with a huge amount of effort and enthusiasm as ever. So thank you guys for being here with me and running the show literally with me. And now introductions to our panelists. We have 6 extraordinary people coming to talk to us. Helen Rochford-Brennan will come from Ireland. She's a very important dementia advocate. We'll have Kimberly Butrum, who is the Senior VP for Clinical Services at Silverado, which is a care home group in the USA. We will have Hannah Kimani that joins us as a carer from Kenya. Alison Canty, who is an associate professor at the Wiki Dementia Research and Education Centre in Australia that does the famous MOOC in Tasmania. Dr. Millie Wai, Vice President and Associate Professor at Kingswood Nursing College of Macau. And Koh Hwan Jing. Hwan Jing is the Senior Assistant Director, Caregiving and Community Mental Health Division at the Agency of Integrated Care in Singapore. So each of these speakers will give us a different perspective. We'll start with the human perspective, Helen. We'll pass to practical issues with Kimberly. We'll go to Hannah and give us the perspective of the carer. Then we'll move to formal education with Alison. Millie will give it applied to the nursing profession. And Hwan Jing will finish by explaining us how all these good practices can really go into a government system and how you can enhance all of this for all of us. Then we will open for a Q&A for 50 minutes. Now, without further ado, I'm going to hand the floor to Helen Rochford-Brennan for her presentation. Helen, over to you.
Thank you, Paula. As a person living with Alzheimer's, I want to begin with something that's often overlooked in dementia education, and that is our voices, our experiences, our knowledge, our truth, and our sense of purpose. Our experiences, what they're like. Because education isn't just about professionals learning about dementia, it's about society learning to include, respect, and learn from those of us living with it. When I was first diagnosed, I remember the silence, the lack of information, the uncertainty, the long, lonely drive home to tell my husband and son. I was handed a diagnosis, but I did not have a pathway. I didn't just want to know what was happening to my brain. I needed to know how to help people and to keep me living and loving. So it's important that I was thought that from the beginning, but it wasn't. And sadly, this is still the case today in so many places around the world. So when I talk to you about enhancing education through global best practice, for me, it's deeply personal. It's about ensuring that other practices must begin with human rights and dignity, which I'm sure you all know me for my human rights. Dementia is too often framed only as a decline. I'm still here, I'm still me, I may change, but I won't disappear. And to tell you the truth, I don't plan on going anywhere just yet. The first time I heard about dementia education was in Scotland, which included a human rights-based approach. They offer a full post-diagnostic support with dedicated link worker, someone who walks beside you. This model, back in the days, gave me hope. And through that, I was able to live better, and it showed me how it was possible. But today in Ireland, the Alzheimer's Society of Ireland have followed a similar path and give amazing training to all. In Canada, particularly in some First Nation communities, that feels meaningful to me because dementia education should honour identity and not erase it. In Japan, the government invests in public education campaigns and dementia-friendly schools. In Uganda and Kenya, NGOs train community health workers to recognise dementia and support families. These are powerful reminders that education just doesn't have to come from a textbook. It can come from a neighbour, a nurse, a teacher, or a friend. I believe people with dementia must be included in designing and delivering education. I've spoken at universities, webinars, and training sessions. I often see professionals shift in the way they stop seeing dementia as something scary and start seeing us as people. Their family, their friend, their client, or themselves. And that's why co-design is vital. Here in Ireland, we have the Understand Together campaign, which is through our Department of Health, and we have the National Community Engagement Programme, which is through the Alzheimer's Society of Ireland. And both are dementia inclusive, looking at dementia inclusive communities. And of course, in the UK, we have DEEP. So we write guides, we lead workshops, and we advise the materials. These tools are easy to use and grounded in the lived reality. One tool I love is the Dementia Dictionary, the online resource. It helps carers interpret expressions and behaviours that words can't explain. It's not perfect, but it's practical and built with us, not just for us. Another example is, of course, in Australia, the TED Talks programme. For me, it was fun. And using virtual reality helps staff see the world from our different perspective. I wish every country could offer that. Best practice also means being culturally aware. I met people from Eastern Europe, Latin America, and Asia who told me their families hide dementia because of stigma. In some languages, there's no word for it. Even in Europe today, there isn't. That's my education has to start in communities and ways that make sense locally. And education shouldn't be limited to healthcare. I've had joyful encounters in cafes and social clubs where staff had dementia awareness training, and painful ones in hospitals where professional the clinicians can play an important role in training. I also want to say something about hope. When I was first diagnosed, I thought my life was over. But then I met others living with dementia. I learned that education doesn't just inform, it uplifts. Training, which is when my journey into light began, was through cognitive rehabilitative therapy. And that was my education. Because then I began to find purpose again, and I began to share my voice. And through that, I found joy. We need to stop reinventing the wheel. And I want to say that again. I'm getting tired of 13 years of seeing reinventing the wheel, so I want to stop. Uganda, Ireland, many, many more. Let's share it, translate it, adapt it. Let's build global bridges, not silos. Because I don't want the next person diagnosed to feel like I felt, confusion, loneliness. I want them to feel what I feel now, connection, clarity, and community. Dementia education can do that. It can help people see beyond symptoms and see the human being still here. Let us remember education is the most powerful weapon which you can use to change the world. Well, Nelson Mandela said that, and I believe it applies here more than ever. Education can turn fear into compassion, it can turn isolation into inclusion, and yes, it can bring joy and laughter. I've felt joy when a carer or a family member says, "Now, Helen, I understand." So let us put dementia education at the heart of change, that it is inclusive, hopeful, and real. Let it be led by those of us who live it. Let it be local, let it be vocal, let it be global, digital, and human. Because at its best, dementia education doesn't just help us understand what's changing. It helps us remember what remains: love, connection, meaning, and above all else, hope. So please, let us put dementia at the heart of change. And I will mention again hope, because today, hope is all I have.
Thank you, Helen, for your wonderful presentation. And as somebody said in the Q&A, you rock. You do rock, but you also remind us that hope is what most people just have. There is not much else, sadly. But this is why we are here, as you remind us, to develop ways to have hope in the moment that we still don't have treatments for everybody, in order to be able to do the best that we can for those that have it. So thank you for your intervention, which I can see how it has inspired our audience. We got 455 people online now. More are still joining. Thank you for joining. I should remind you that we have subtitles in over 45 languages. The webinar will be available and the slides after the webinar finishes on YouTube. Obviously, it won't be possible to do a Q&A and interaction. Now, swiftly, let me pass to the second speaker, Kimberly Butrum from Silverado. Kimberly, the floor is yours.
Thank you. Appreciate that. All right. Well, I'm excited to be able to share today 2 ways that we have actually used our ADI accredited educational and training program in working to change culture and reduce stigma. So next slide, please. Go right ahead. First, let me share a little about us. Silverado has 26 memory care communities that are all secured and specialized, only giving memory care services to those living with a memory impairing disease from mild cognitive impairment through to end of life. And we're a purpose-driven company that actually works to change the world in the way memory care services are provided and to improve our residents, families, and our associates' quality of life. Next slide, please. So for nearly 30 years since our founding, our core foundational clinical concept has been normalization. And normalization, when used in relationship to people living with dementia, really says, see that person living with dementia at exactly the same dignity and deserving of the same respect and full value as someone without living with dementia. Because normalization understands that sometimes people living with dementia may be at risk of devaluation. Next slide, please. So when we talk about Thank you. So, Helen said so well that, despite a national focus on person-centered care for more than 20 years in the United States, in certain regions and particularly in certain settings, and I noted that Helen mentioned particularly healthcare settings, there really remains significant work to be done to reduce stigma, individualize care, and really move to a person-centered approach. And not just move to that person-centered approach, but really fully embrace the concept that one can live with dementia and continue to thrive. Next slide, please. So some of the ways that Silverado provides educational and training offerings includes things such as virtual dementia tours, educational programs, something we call Look at Me Nows, and having our residents participate, of course, and then having tours of our communities. So let's look at each of those individually. Next slide, please. So a virtual dementia tour is an immersive experience. It's through Second Wind Dreams, and it really allows people to better understand what it is like to live with dementia. And in providing a virtual dementia tour, our goal is to help caregivers, family members, and particularly it can be impactful in healthcare settings for people to be able to walk in the shoes of someone living with dementia. So we often use it as a first step to then be able to begin to break down the stigma, especially in healthcare settings, of professionals, nurses, and staff members. Next slide, please. Here's a photo of providing a virtual dementia tour at a large hospital here in Southern California. Next slide, please. Here's photos providing a virtual dementia tour to first responders. As often, sometimes the first responders really don't have extra training necessarily in terms of someone living with dementia, and there's a lot of misperceptions. Next slide, please. Now, I love sharing Look at Me Nows. This is a tool that we use often where someone has moved into one of our memory care communities. And when they have moved in, they may have had a very difficult hospitalization. They might have had a secondary delirium. They may have had agitation in the hospital. They may have not been handled well from a discomfort standpoint or had an infection. So the hospital, acute hospital, may have a perception of that person living with dementia as being someone in 4-point restraints in an acute hospital bed. And that is not what we want them to understand as someone living with dementia. So what we will often do is once someone has moved into our community, they have found their purpose, they have, we've stabilized their medical condition, we take back to the acute hospital a photo of them from when they moved in and then what they're doing now in terms of thriving, whether they're participating in our resident volunteer program or a variety of other options. And that really is powerful to break down the stigma, that people have, especially in a healthcare setting, of people living with dementia looking a certain way. Next slide, please. And of course, the other educational programs that we often use are talking about how to reduce excess disability. Healthcare settings are notorious sometimes for assuming someone living with dementia can't do something, rather than they may simply need a bit more time to do it successfully. And then the particularly powerful tool I wanted to mention is to bring one of our residents with us, because people don't think that someone living with dementia would necessarily be leaving their memory care environment to then share with healthcare settings or other things how they continue to thrive throughout the course of their disease. Next slide, please. I love this slide. This is when we talk about having people tour our memory care communities. There is such stigma in terms of what residential care for someone living with a dementia may be. And so often when a visitor comes and tours one of our communities and may see someone living with dementia continuing to barbecue under the watchful eye of our culinary director, or next slide, please, cutting vegetables for dinner. Those are all the kinds of things that often, unfortunately, in many settings, people don't have the expectation that you continue to have purpose and make a difference throughout the course of your neurodegenerative disease. Next slide, please. The second way, and this has more of an international focus that I wanted to share in terms of our educational and training program, is a cross-cultural collaboration that we actually shared at Krakow, Poland at ADI last year. And that was Dr. Mette Andresen of Denmark has a specialty in cognitive rehabilitation. And she had actually visited some of our Silverado U.S. communities and observed our brain health program and the foundations of our model of care, which she then piloted and implemented in nursing facilities in Lolland, Denmark, using it to change culture. And Dr. Andresen was actually able to demonstrate improved outcomes in staff retention, residents' cognitive and functional status, and that was all similar to what we had seen in the US. Next slide, please. So this is the poster. Next slide, please. And I think particularly powerful were some of the comments from the staff in the facilities in Denmark, who shared what are really very simple actions, but sometimes we forget in residential care to offer to our residents. Things such as asking a resident what they wanted to do, talking to a resident and moving away from that task orientation down to really a cozy feeling in the dining rooms, introducing them to each other and really asking about interests. One of the particularly powerful stories was that there was a resident who wanted to be able to transfer himself. And when he understood that continuing to bike to the village, he wanted to stay independent. Once the staff knew that, they could really facilitate that to build up his rehabilitation so that he was able to regain that ability to transfer independently. So there are lots of ways to continue to work to reduce stigma. And to Helen's earlier point, unfortunately, I would say there are still many opportunities for sure in the US. So thank you. I'll stop there.
Thank you very much, Kimberly, for this super interesting presentation that has prompted a lot of questions. Thank you, everybody, for putting the questions. Remember just to put the questions in the Q&A and introduce yourself in the chat. We'll have time to pick up some of these questions later. Kimberly referred to a poster that they presented at the ADI conference in Krakow last year. Next year one, there's going to be the one in Lyon I mentioned earlier. Now, swiftly, I'm going to hand the floor to Hannah Kimani, who is a carer from Kenya, reminding Hannah and all the subsequent speakers to please keep to their time slots so that we have time for the Q&A. Hannah, the floor is yours.
Good afternoon, everybody. This is Hannah Kimani from Kenya. I'm a caregiver to my mom, as I've stated there. Before I was a baker, I stopped my work to be her caregiver. I've been her caregiver now for 5 years and 7 months. Next slide, please. That's my photo with her there. That's my mommy there. And we all say hi from this end. Next slide. Next slide, please. So who is a caregiver? Caregiver is an individual who provides support and assistance to any person who needs help with daily living activities. And daily living activities means anything that you can do for yourself without assistance. When one gets dementia, they are not able to do most of the things that you and I can do. So this caregiver can be a friend, a family member like me, a spouse, or a paid professional. Caregiving includes what do we do for them? We support them in every other way. We assist them. We offer them companionship. We ensure their safety, administering first aid and when a need arises, giving medicine, taking them to medical checkups and follow-ups on the same, and many more. Next slide, please. So it is very important that when one is a caregiver, gets training and a lot of education on how to go about this, because it equips caregivers with the necessary knowledge and skills. And it also helps one manage demands of their role, helps caregiver gain confidence to the safety and effectiveness, and to offer compassionate care. It also helps to improve the well-being of both the carer and the care receiver. Fosters a positive caregiving environment, gives overall information on how to go about their role. Next slide, please. We have the 4 C's of caregiving, which are care, compassion, courage, and commitment. You need all these so that your work can be perfect. Challenges of caregiving. this is where I'll put a lot of emphasis on. When you're a caregiver, you have time constraints. Like you don't have time to be with friends. Every minute is being taken by the role. There's also emotional strain, whereby you have to offer emotional support to your care receiver. The financial burden, whereby the family has to take care of, say, bills in the hospital. If they have a professional caregiver, they have to pay them and all that. Potential health impact, mostly mental health, that most caregivers go through. There's also sleep deprivation, whereby one can hardly have a sound sleep. Like you're asleep and your care receiver needs your attention, you have to be there for them. There's also a feeling of isolation, like you are always with them. So you are kind of locked from all over, from all the rest. The emotional toll of witnessing a loved one decline day by day. This one has taken toll on me because at the moment, my mom is on a downtrend. She's not doing very well. And sometimes you also feel like you don't have the kind of support you'd like from the family members, maybe from the government, maybe from the society, the professionals, like doctors. Doctors who deal with dementia never give the news the right way. They always use very big terms and they tell you things are going this way or that way. The friends, most of mom's friends come to visit her. Sometimes the visits are good, but sometimes they take long. Here, being Africa, the visits can be so long, and maybe I need to do 1 or 3 things to her. Then the church, you may expect that because she was a church member, they'll keep offering spiritual support. Sometimes it doesn't happen. Next slide, please. So when I was going through this, I joined EDOC. EDOC is the Association of Dementia Organization Kenya support group in the second year of my caregiving, whereby we hold monthly meetings and a lot of information is shared concerning dementia. I also joined another support group, which is mainly virtual. Then different professionals are invited and give topics on caregiving, which is very, very resourceful. I also enrolled in an online course with the University of Tasmania in Australia, and it helped me to know a lot about dementia and how it progresses, what I should expect at what stage, and it helped me a lot. Next slide, please. So I also joined Suruvi, Care for Caregiver. This is where now my life of caregiving took a turn around. Because when I was there, I was taught that I matter a lot. I was taught about the importance of rest as a caregiver, coping with the stress that comes with caregiving, depression, guilt, how to perform first aid, how to prepare and handle end of life season, and how to assure a patient. Next slide, please. I want to believe she felt the hand of it this time. And I think now I'm able to cope with the journey much easier, much knowledgeable, much confident than I was before. So I think every caregiver needs this kind of training. I don't know what I would have done if I didn't attend it. Thank you for that. Next, please. Thank you for that, Megan. That is a part of a video I did after I did my course with Ruby, Care for Caregivers. Here I was taught how to take care of myself, how to handle the role better, how to know what to expect at what time. But the best part of it is that I was taught who I am in the role, why I matter, why I should do everything with confidence, and what being with my mom means to her. Then there I've written, there's in dementia patients, they like talking about going home. I want to go home. I also learned that when she says this, in Africa, when an elderly person talks about wanting to go home, it's very alarming because plainly put, they mean they want to die. But I learned in dementia when they say that, mostly they are afraid. They are not sure of the environment they are in. And so with my training, I was taught how to handle that. I was also taught about nutrition. Mom right now doesn't have a lot of movement. She's asleep most of the time. She is also not active. So when it comes to nutrition, she doesn't need a lot of energy-giving food, but she needs foods that help her to build the body, to give her more energy. So I was taught how to serve her such kind of food and in the right portions. Next slide, please. There's also about conversion that I learned, the choking, the safety, and mostly about communication, communicating with dementia patients. At the moment, she doesn't have a lot of talking, but you know what she does? She talks to me through holding. When she holds my hand and presses it, I know that she's telling me, thank you. I know that she's telling me, I'm still here, we are going on. So that taught me that instead of being sorry that she's not talking to me, I was taught how to communicate to her. I was also taught that I should go to her world. Like we'll be here and it's all sunny outside. And she's talking about it raining so much. And I'll tell her, yes, it is raining. But for sure, there's no rain outside. Why do I do that? So that I can help her to keep into her world and continue communicating to her. So I can say this, that training for caregivers is very, very important. I would advise all caregivers to go into training, to learn a lot, and especially how to take care of them, themselves in the whole role. Mother Teresa said, care until it hurts. Love until it hurts. I say care until it hurts. Thank you very much.
Thank you so much, Hannah, for your wonderful presentation that has had some amazing feedback. Thank you. And also for bringing up some very practical issues. You know, you can change policy through taxation, for example. You can make people's lives easier. This is the kind of simple but very, very important things that are very difficult to get governments to change. But if changing could really improve the life of everybody. And I know that ADOC in Kenya is doing a lot of advocacy with the government. So thank you for your support. Just reminding everybody, a lot of people are still joining. Q&A for the Q&A, and please put your introductions into the chat line. And now swiftly pass to Alison Canty, the Associate Professor of the Wiki Dementia Research and Education Centre in Australia, to talk to us about that wonderful MOOC that many people have done, including Hannah. Alison and the subsequent speaker, can I please ask you to keep yourself to the time? Otherwise, we won't have time to the Q&A. Thank you so much. Alison, the floor is yours.
Thank you, Paola. Today I'm joining you from the lands of the Palawa people of Lutruwita, the traditional custodians of the place that I call home. Welcome. In the next 8 minutes or so, I'm going to share some web links. So please have a pen and paper ready or get your screenshots ready. You'll be able to access some free evidence-based education through these links. So my name's Alison. I'm joining you from Hobart, Tasmania, and I'm at the Wiki Dementia Research and Education Centre. Here at the Wiki Centre, we are a group of about 84 staff from a range of disciplines, and we have about 1,500 students. And what brings us together, if we can go to the next slide, please, is a shared interest in the diseases that cause dementia. And together, our mission in our centre is to make a difference to the lives of people living with dementia and their carers, and also to deliver globally recognised and high-impact research and education. We were established in 2008, and our research focuses on the care, cause and prevention of dementia. It stretches from laboratory-based research to developing new biomarkers and also community approaches. For example, right now we have an ambitious project, the Island Project, with over 14,000 Tasmanians in midlife who who are working to decrease the level of dementia risk in Tasmania through knowledge-based initiatives. Next slide, please. So our mission is not only to generate knowledge, but also to share it. And that's where we're having our greatest impact. In our country and also around the world, we know that the health systems are not well oriented towards providing quality dementia care. And we know that dementia literacy is poor across our communities. And when it comes to training our health professionals, there's very little dementia education, and knowledge in the workforce remains inadequate. In the 2024 ADI World Alzheimer's Report, we were reminded that 65% of healthcare professionals and 80% of the general public incorrectly believe that dementia is a normal part of ageing. So what are we doing about it from down here in Tasmania? Well, we are ambitious in our mission, and we want to provide accessible evidence-based education about dementia that is deployable at scale across the globe. And we're doing this via free online courses, our MOOCs, massive open online courses. Another way we do it is to work with the Australian government to provide free tailored education for our aged care workforce. And we also offer a suite of university courses for those who want more depth and breadth in their education. But in terms of global impact, really our successes have been in our MOOCs, which are completely free and designed for anyone who wants to know about understanding dementia or preventing dementia. Next slide, please. So our MOOCs have recently shifted to an always-on mode. So you can sign up at any time to these fully online self-paced courses, and they're completely free. I'll say free lots of times today. So if you remember nothing else, remember that all our education is free. We're currently refreshing our MOOCs, and they will be ready to be re-released later this year. And to date, we've reached about 700,000 people around the globe. And if you're listening today, you might be one of those 700,000. And if you're not, I really would like to invite you to join us. This year alone, we've had about 50,000 people sign up to our collection of MOOCs, which also include MOOCs on understanding traumatic brain injury, motor neuron disease, and Parkinson's. So we experience completion rates of our MOOCs of about 40%, much higher than most online courses, and this tells us that we're getting the design right. The courses contain a mixture of video learning with captions and downloadable transcripts, infographics, games, quizzes, web resources, and a certificate that you can get when you reach the end. And no matter what the background of our participants, our evaluation demonstrates a significant increase in understanding of dementia by the time you reach the end of the course. Our MOOCs have been translated into different languages. The Preventing Dementia MOOC is fully translated into Nepali, with plans to translate it into Farsi, Hindi, and Japanese. And our Understanding Dementia MOOC has been translated into Mandarin and also into Czech. And we're currently exploring AI tools to increase the speed of our translations that include both cultural and linguistic translations. Next slide, please. Next slide, please. Thank you. We also work with the Australian government to create industry-focused education. And most recently, we developed the DREAM project, you can see on the left, which is Dementia Respite Education and Mentoring. And there are 5 free education modules there about the provision of respite care that are available globally. And then within Australia, we have a community of practice and some in-person coaching opportunities. Over on the right of the slide, you can see some learning packages designed for people who are entering the aged care workforce in Australia, our Equip learning packages. And these are also fully online and they're free, and they have modules at the introduction and the refresher level. Some of these are focused on the Australian aged care sector, but many of the modules are relevant across the globe. Next slide, please. So for those of you who want more in-depth information about dementia, we have a suite of fully online courses from entry level in our diplomas right up to the master's and PhD level. Our courses are fully online, they're accessible, they're flexible, and they have no exams. And we have tuition fee waivers for most students in the Diploma of Dementia Care, which is our most popular course. Independent national surveys tell us that that we are getting this style of education right, and our students take what they learn in their class and then they can apply it to their workplace straight away before they even finish their courses. So at this point, you might be wondering, who are these 700,000 people and that have signed up for our education courses? Let me tell you a little bit more about them. Could you go to the next slide, please? So all kinds of people. I don't think you have it there because it came as a late addition. So I'll just talk to you. We don't need to look at the slides. All kinds of people sign up for our courses. And I did have some pictures of two people in particular, Maddie and Peter. They have done our MOOCs. Peter is living with dementia and Maddie is his wife. And Peter really remembers the MOOCs. He remembers the feeling of listening to the stories of people who are living with dementia and what that meant to him. And when I asked Maddie, what should clinicians do to care for you better? There we are. She said, they need to do your MOOCs because there's something in there for everybody. You can see them there in the top left. And Maddie and Peter have now come in to share their own stories, and they'll be part of our new Understanding Dementia MOOC when it gets launched later this year. You can also see a photo from another chap there on the left. His father was diagnosed with Alzheimer's, and they were unsure what to do, and they found our MOOCs, the Understanding Dementia and Preventing Dementia MOOCs, and this gentleman went on to do the full Bachelor of Dementia Care and really translated his knowledge to help his family to understand how to best care for his dad. So thank you for listening today. I hope there's something in my presentation for you, and again, I'd encourage you to sign up to our free courses. They're available anywhere with an internet connection. Thank you.
Thank you so much, Alison. It's been lovely to see some of the comments in the chat. So many people have done your MOOCs and I've really appreciated them. We are ADI accredited providers of excellent dementia courses, and it's been a joy to do your accreditation, as it has been a joy to do the accreditation for the next speaker, Millie. Because when we find excellent things, in your case, even free, why shouldn't we tell more people that this is available and that this is excellent, and it really, really helps people also frame intellectually, frame compassionately everything that they do so that they know they're doing the right thing. So thank you for the fabulous work you guys do. Now I'm going to cede the floor to Dr. Millie Vai, who is the Vice President and Associate Professor for the Kiangbu Nursing College of Macau. They were the first organization that we accredited, a real great example of fantastic practice, in this case for formal education of nurses. So, Millie, we are all looking forward to hearing from you. The floor is yours.
Yeah.
Keep to the time.
Thank
you.
Thank you, Paula. Hello, everyone. I'm appreciated to share with you about the experience of Macau in enhancing dementia education. My slide, please. Okay, thank you. Next, please. First of all, have a quick look of Macau. We are located in the southern part of China, and we are a special administrative region of China. We have it is a very small city with only 33.3 kilometers, square kilometers, and with a quite condensed population. And our GDP is good. Quite good, but we are still striving to maintain this income, because after the COVID-19, and it is really challenging. And then we receive a lot of visitors every year, and our life expectancy is one of the highest in the world, 83.3 years old, and the older people aged 65 years old is accounted 65 or above is accounted for almost 14.6%. Next, please. Next slide, please. Yes, thank you. And then according to our Macau Dementia Registry cohort, around 3,000 people with dementia were diagnosed, and the diagnostic rate is about 50%. And most of them are from Alzheimer's disease, and also 30% of them were vascular dementia. And nearly 90% live in the community, and most of them lived with their families. The next slide, please. Okay. I want to skip this line, please. Thank you. Yeah. In our college, Koh Hwan Nursing College of Macau, KWNC, was founded in 1923. It is a subsidiary institute of Koh Hwan Charitable Association, and we are revolving from the former Koh Hwan Senior Nursing School. The college is the longest-standing nursing education institute in Macau, and we have successfully completed an institutional accreditation conducted by the Quality Assurance Agency for Higher Education of UK. And also in the same year, in 2023, nursing education accreditation conducted by the Netherlands Education Quality Evaluation Agency of the Ministry of Education of PRC. So we are adopted a continuous quality review and quality assurance system in the college. And then we are committed to provide nursing and multidisciplinary high-level programs to effectively meet the evolving social needs and healthcare developments. And we are now providing bachelor, master, and PhD levels in nursing education, and also we have master level of applied gerontology programs. And the next slide, please. And in the college, we have established a Nursing and Health Education Research Center in 2012. And this is an implementation of combining teaching, research, and social services. The center started to provide social services in the field of nursing and health sciences, including the integration of teaching and research elements. We try to move from single discipline, nursing, to cross-disciplinary collaboration through establishing community partners locally and regionally. Next slide, please. And then in the center, we have three main projects. The first one, Beneficence Lights Up My Later Life, is a tailored mega program to face the aging population in Macau. And this is the one that is related to our dementia education. Please, next slide. And then, as you see, our college educational philosophy is from personhood to benevolence. And then in this project, we believe that we deserve to be loved and be respected as we grow older. So this project's concept is to support active aging and also care for the older adults of the society. The objectives of the project is to educate appropriate understanding and positive attitude towards the aging population amongst the public, and to provide basic knowledge and skill training for carers caring for older adults, and to enhance geriatric specialist knowledge for professionals. The next one, please. And as you see, we adopted public strategies and also workforce strategies. For the public education, we try to provide seminars about prevention and care for people with dementia. We say seminars and also programs. And then we also provide chronic disease management and hospice care education, healthy aging and cohesion of intergenerational relationships, etc. And then in community surveys and research, we provide cognitive ability assessment, and also we provide dementia surveys hotline, and also chronic disease management, life and death education. And for scholar training, we provide online self-learning courses for professionals and dementia courses for professionals, and also training workshops for professionals, field trips, and vocational studies. And the next slide, please. Okay, and here you can see the varieties of the public education that we provide. We have lectures, workshops, websites for learning, and also we train youth ambassadors, senior ambassador. We also produce micro movie production, and the movie is still online. You can search from YouTube about how we educate the public, but it is in Cantonese. And then the leaflets and also cognitive salon for the daily care centers, and the teaching materials for dementia care. And also we 6 categories of people were listed as key targets for raising awareness of dementia. And for example, the police officers, bus drivers, buildings, security guards, so on, and they are we provide continuous training to them. Yeah, and then those programs have engaged more than 100 seminars and training workshops, benefiting more than 10,000 participants. And the knowledge about dementia has significantly improved according to the survey that we collected after these activities. And so please, next slide.
Millie, sorry to rush you, but you have to rush because you are going over time. Thank you.
These are all the content of our scholar training. Yeah, that we also send scholars abroad to receive continuous education. So next slide. Yeah, and in 2021, we are accredited as a program provider by ADI. Yeah, next, please. And then we continuously provide the next one, please. And yeah, the next, please. And in 2022, we run the dementia care organizer programs, and until now, we have trained 159 dementia organizers. And then most of the students were satisfied with the course. And also, I would like to share with you about the dementia care is a dementia caregiver programs that we have also run 2 of it. And then the caregiver, the response from them saying that they learn more about the disease trajectory of the disease, and then they understand how to they have a preparation of the changes of their family who have dementia, and also they learn about person-centered care from the program, and they think that it is a support to them. So the next slide. So yeah, we in this presentation, I highlight the public engagement and health professional education, and we will continue to facilitate and encouraging combination of education, research, and social practice, and aiming to cultivate a dementia-friendly community in Macau. Thank you.
Thank you very much, Millie, for your great presentation and for all the amazing work you do. Lots of people in the chat have been thanking you. I'm going to pass very briefly, very immediately, the floor to Hwan Jing, who is going to frame this from the point of view, once you know all these wonderful things, what can a government do to enable people to apply all of these at a scale, which is what Singapore is doing. And so many of you in the chat have said, this is so great, but it's not happening in my country. Some of those countries are very rich countries and it's still not happening. So Hwan Jing, how are you tackling this from a government perspective?
Thanks, Paula, for the introduction. Thanks, ADI, for the opportunity for sharing at this platform. So today, I'll share with you the work that Singapore has been doing in the area of dementia education and training. And today I speak as a staff member of the Agency for Integrated Care, and also as someone who has worked in the community care sector over the past 10 years. Next slide, please. So Agency for Integrated Care, AIC for short, is the appointed agency by Ministry of Health to implement health and community care strategies for Singapore. So we play a very unique role to reach out to seniors and clients to understand their needs, connect them with services that require financial assistance that may address their concerns. And we also partner community care organizations to design and deliver services to address the needs of seniors as well as people with mental health and dementia conditions. We work across community care organizations to facilitate partnerships and care transitions, and we also uplift the sector through workforce transformation as well as other enablement initiatives. Next slide. So as an agency, we envision to create a vibrant care community for our people to live well and age gracefully. And we do that by empowering seniors and clients with resources, services, as well as schemes so that they can stay well and active with a peace of mind. And we transform the care community by designing care around seniors and clients within their local community and building a robust and capable community care sector. Next slide. So as with most countries in the world, dementia is a rising concern, and in Singapore, 1 in 4 aged 65 and above, by 2030, 1 in 4 will be age 65 and above, and the projected number of people living with dementia will be more than 150,000. So with this, there is an increasing risk of social isolation. We know that there will be more chronic and long-term care conditions that need to be addressed, more hospital visits, and along with that, there will be increasing number of seniors that may have mental health needs as well as dementia. Based on a recent study that was concluded by the Institute of Mental Health in Singapore, we know that in Singapore right now, there is 1 in 11 people aged 60 and above that have dementia. However, despite the rising number of people with dementia, we are proud to say that the treatment gap has actually dropped from 70% in 2013 to 51% in 2023. We believe that this is a testimony of the work that we have done to raise awareness of dementia, to educate people about dementia, and also to build the capability of the community care sector to support persons with dementia. Next slide. So in Singapore, dementia care is embedded in our ecosystem of caregiving and community mental health. And we do that with guidance from the Community Mental Health Master Plan and Caregiving Support Action Plan that is driven by the government. Over the past few years, we have focused our efforts in building services close to home for seniors and people with dementia through our community outreach teams, as well as the community intervention teams. Community outreach teams have been reaching out to seniors as well as active aging centers to raise awareness of dementia, to conduct targeted dementia screening, and also to provide support and early intervention to people that have possible signs and symptoms of dementia. Community intervention teams are available to support people that may have behaviors of concern and also high caregiver stress due to the mental health conditions as well as dementia. Most people are still being diagnosed in the memory clinics based in the hospitals. So for those who are diagnosed with dementia, they are also able to leverage on the support provided by our post-diagnostic support services. Along with that, we've also done a lot of work to educate frontliners and community leaders on dementia by providing awareness talks, rolling out free e-learning courses, and running blended workshops to community leaders to help them to identify persons in the community that may have signs and symptoms of dementia and to signpost them to the support that they need. Much work has gone into developing caregiver support networks, rolling out caregiver training programs, as well as expanding the capacity of our center-based and home-based respite services. Next slide. In addition to building formal services, the Dementia Friendly Singapore movement has also done significant work in raising the awareness of dementia in the community and also reaching out to community partners that are willing to come on board to create dementia-friendly communities. To date, we have 16 dementia-friendly communities and more than 800 dementia go-to points island-wide, which serve as safe return points for seniors or persons with dementia who have lost their way and need some support. And they double up as resource centers for caregivers and members of the public who want to know more about dementia. At the same time, we are also driving efforts to promote the dementia membership program through the CARA, such that more people can be on board to embrace the dementia-friendly movement. Next slide. With the dementia care ecosystem in place, much work has gone into capability building. So how we do that is through the implementation of the Dementia Care Competency Framework. And this Dementia Care Competency Framework has helped us in organizing how we roll out training for different tiers of people involved in the care of persons with dementia, from members of the public, volunteers to professional care staff, as well as specialists who are providing consulting or play a guiding role in their workplaces. We deploy various methods of training according to the various tiers of competency. And alongside that, we've also been developing digital resources, including e-learning, to enable anybody to be able to provide dementia care training according to the Dementia Care Competency Framework. Next slide. So these are examples of resources that you can tap on if you're interested to apply the Dementia Care Competency Framework. We have since developed the assessment framework, which provides guidance on how you can use the assessment criteria to conduct competency assessments for staff who are providing dementia care. There is an accompanying e-learning guide which tells you how to identify the tier of competency that your staff belongs to, and also provide suggestions on the types of learning that should be made available to care staff. And at the same time, we have also been running workshops to guide care providers to be able to come up with their own competency assessments, either through case studies or role plays, so that they can better ascertain the competencies of their staff. Digital resources are constantly being populated on Dementia Hub so that anyone who's involved in training is able to tap on these resources to guide their training programs. Next slide.
Hwan Jing, I need to ask you to hurry though.
I'll quickly
end up with time for Q&A. Thank you.
So just a quick one. I just want to say that the Dementia Care Competency Framework is but just one of the domain-specific competency frameworks that we look at. So at AIC, we are striving to build a comprehensive community care learning ecosystem whereby we appoint training providers who are able to roll out training to the community care sector through the application of the various competency frameworks that we have developed and implemented. Next slide. And last but not least, as Singapore is a small country, we do leverage on international networks to be able to build the competencies of our people. So at AIC, we have a strategic partnership with Dementia Singapore, whom we know has been working with various international institutions to be able to roll out training for community care staff, including the University of Bradford, Dementia Australia, as well as Namaste Care International and Humanitude. And one good example of how we have worked with international bodies to build competency is through the Namaste Care training project, whereby we worked with international experts to bring in the training locally. And since then, our Learning Institute has rolled out Namaste Care training to care homes who have been able to implement this program into their facility. I shall end off with the last slide, happy to hear any questions if you have. Thanks.
Thank you very much, Hwan Jing. Brilliant and inspiring presentation. Lots of congratulations in the chat. I'll be super quick though, and I'll move to the questions because we don't have a lot of time. Reminding you of the ADI accreditation, you've just seen the slide. If any of you provide training and would like, you think you've got best practice, you would like an ADI accreditation, please scan this code and get in touch with Amalia Foncutomo, who is with me on the webinar. Now, quick question. First one to Helen. Can I ask you for literally 15 seconds answers? I know it's impossible. How to engage a person with dementia in the family home? Helen, you mentioned some tools. Where can people find them?
With tools, engaging the family home, or just tools in general? In general, on the Alzheimer's Society of Ireland website, we provide a lot of information.
So the Alzheimer's Ireland website, for those of you who ask.
And the training available.
Thank you so much. A question for Kim. Kim, reminiscence therapy, is it part of the virtual dementia tours? And how do you think your programs also changes the perception on stigma for people that work in acute hospital?
We do. I will say that the validation and reminiscence is a part of our training. So absolutely, it's built into that. The virtual dementia tours, what we hear, we do evaluations every time we do a virtual dementia tour, and people don't realize it encourages them to perform everyday tasks with some sensory impairment and difficulty in that way. And so we hear consistently that they really didn't realize. And then, of course, your facilitator walks people through after they've completed the virtual dementia tour.
So it really works, doesn't it? Hannah, a question for you. Again, very briefly, what recommendation do you have for professionals to help other caregivers, informal caregivers, who may not know where to find the information that they need to do the kind of things you have learned?
The MOOC is a good start. I would encourage them to enroll. I don't know if Suruvi can offer the training online because I attended the physical training here in Kenya. I advocate for training for every caregiver, especially about self-care.
Fabulous. Thank you, Hannah. Alison, the next one is for you. Are you thinking of creating a MOOC for living well with dementia? Lots of people have asked this also in the chat.
Yeah, that's a great question. I would say that we have a lot of that already in our Understanding Dementia MOOC. And that particular MOOC is being refreshed at the moment and will be relaunched just after World Alzheimer's Day in September this year. And so we have lots more personal stories and more of that kind of thing in there, which is what others have already asked for. So if you've done the MOOC already, come back and do it again.
Fantastic. And we'll all wait for it after World Alzheimer's Day, which I remind you is the 21st of September. Although this year we will launch the World Alzheimer report on rehabilitation on the 18th for technical reasons, which we'll explain to you online. So follow our activity. Millie, do you have culturally sensitive inclusive courses for minorities like LGBTQ or neurodiverse people who have dementia? The question comes from Renu Vora, who is the chair of ARZI, our Indian organization.
Yeah, before we didn't have, but in the next round, we are now planning to develop more programs. And then I think this is a good suggestions that we can take it into account and have more input on this issue. Thank you.
Thank you so much. Hwan Jing, the last one is for you. Is your well-being program self-funded and means tested for your citizens, or is it funded by the government? And by the way, everybody loved your safe return points.
Sorry, did you mean the services for people with dementia, whether they are funded by the government?
Yes.
Okay. So our community outreach teams and community intervention teams are fully funded, so they can get support free of charge. Our post-diagnostic support services as well. It's only when they go to the hospital or the memory clinic to get the assessment and diagnosis that's when they need to pay for the consultations.
Okay, thank you very much. Very useful that. Now, I have a last question that has popped twice in the Q&A, and if one of you could volunteer to answer it, is a person from India who is asking what to do when there is an issue in a household of having a person whose first language is not the original one. So he's from India and his mother-in-law is from Indonesia, and they have problems communicating with the mother-in-law who has dementia. Would anybody like to suggest a tool, a technique?
Yeah, can I just add to that? It may not be in a house. It may be in a community setting, where actually this just came up yesterday with somebody with me, that somebody is in a community setting and there's a difficulty with language. And the difficulty with language, ladies, was get out Google and translate. And it was as simple as that to make the person be able to communicate.
That's lovely. Somebody else also in the Q&A say, just use a gadget translation.
Yeah.
And not everybody has access to those, so we have to be aware that in certain settings those won't be available, but they are transformative in the way that you can understand people. And of course, this is a topic that would be the subject of a lot more thinking. And again, it's the kind of topic we discuss at the conference in Lyon, where also you would meet people from a lot of different language contexts. So you would have a lot of that. Now, unfortunately, I have to close this session. I thank you so much for following what we do, for being with us until so long, so many of you. And I remind you to follow us on all the various channels that you're seeing in this email, if you know what we are going to do next. And in particular, please register for the World Alzheimer's Day launch of the World Alzheimer's Report this year, and after that for the big event that we will do at the United Nations on the 23rd. That is why we're launching the report a bit earlier. So please do follow what we do. You will receive a lot of emails. Give your email to Jane to make sure that you are on our mailing list and can receive all this other information. There's also a webinar we are doing in December about diagnosis, and I know a lot of you are interested in this. Once again, we know that medical professionals are needed to have better education, even to have the capacity to diagnose. This is why webinars like this are so important. This is why the work that you all do is so important. So thank you for being with us until the end. Thank you to my wonderful panelists for being with me. Thank you to Jane, Megan, and Amalia for organizing the webinar, and to the wonderful ADI team that has done so much work for this webinar too. So see you for the next webinar. Thank you for being with us. Thank you for doing the wonderful things you do. Bye-bye.
Bye. Thank you, John.
Bye. Thank you.